There, Andrew Gorecki, and I'm here this month to share some more knowledge with you so that you can be and stay healthy. The topic this month is the shoulder, and we like to start these number one videos off with a description of the shoulder so you can get to know it a little bit better. And wow, what an amazing part of the body. The shoulder is the most complex joint in the body, as well as the most mobile. It has the most mobility of any joint in the body. And as you can see, it is a ball and socket joint, but we have really four joints, and it should be called the shoulder complex. So the first thing we have here is the shoulder blade, or the scapula. The scapula is actually the socket. So if you highlight the scapula, the bone of the scapula actually is the socket for the ball to sit in. And that means that when the ball moves, the socket must move. So the scapula actually is its own floating bone that rides on the rib cage. So the scapula actually moves along the ribs, and it follows the pathway of the curved ribs. And it's also important to notice that the ribs only move when the spine moves. So the scapula moves on the ribs and the ribs move on the spine. So when we're looking at a shoulder, we also have to talk about those areas as well because they influence the shoulder so much. So we've got the scapula, we've got the humerus. The humerus is the arm bone. That is the socket. You can see that both of these surfaces have some nice hyaline cartilage that allows for the joints to slide against each other and glide freely. But more importantly, we have joint space so that the two bones can actually move. We have a clavicle. The clavicle is the collarbone. You can see that also right here is attached to this bone, the scapula. So there is a joint right in there, the AC joint, the acromioclavicular joint. And then we also have over here another joint where the clavicle, the collarbone, meets the sternum. That's called the sternoclavicular joint right in here. So the shoulder actually has four joints that all have to move at the same time. So you can see how complex that is. Pretty amazing structure. And not to mention all the muscles that surround the shoulder. There are lots of them. Let's start from the back here. You can see that I'm going to layer on muscles at a time. So here we go. This is our rotator cuff muscles. We have four of them. This is the supraspinatus, the infraspinatus, the teres minor, and we've got the subscapularis. Those are the four rotator cuff muscles, and they sit right on the outside of the ball, and they kind of hold the ball in place. They hold the ball in the socket. And you can see right here, this is a tricky spot, kind of neat. This is the most common rotator cuff muscle to get irritated or torn or inflamed or impinged. We'll talk about that in video number 2. You can see that the muscle right here actually goes under this bone. Look at that, it's amazing. So it's an area where this bone and this bone, if there's not a lot of space in there, that can get squeezed and it can start to get damaged. And again, once again, here we are talking about space. The body is happy when it has lots of space between structures. When the space is decreased, that's when we have problems. So we'll talk about that in the next video. Let's look and see if we've got any more muscles here. All right, going to the front of the shoulder, this is the biceps tendon. The biceps actually has two muscles. Here's the long head and the short head. Both of them attach to the shoulder. The short head attaches to the shoulder blade. The long head goes over the shoulder and on the top, and it actually attaches right to the top of the shoulder blade. Right in there, you can see that's got a little skinny attachment. And so sometimes that can tear, biceps tears or biceps tendonitis. Again, it sits in that little space right there between those two bones. That can get kind of dicey. We'll talk about that in video 2. You can see here there's a pectoralis minor. You can see now the big muscles, the pecs. Those are part of the shoulder, the rhomboids, the traps. So we've got a lot of structures here in the shoulder that we'd like to worry about that can go wrong. We're going to talk about in video 2 the things that can go wrong. Let's see what else we can show you here about the anatomy. So this is the capsular connective tissue. You can see the ligaments. lots of ligaments. These little fatty things right here are called bursas. They're actually fluid-filled sacs. And you can see there's one right in here. Right between that space where the bones can meet, there's a roof right here. That fluid-filled sac is designed to lubricate the tendons and muscles and structures in this area. Sometimes we can get bursitis, which is inflammation of that sac. We'll talk about that in video 2 as well. Then we've got also a capsule. Here's a capsule that goes around the shoulder that holds the shoulder joint in place along with the muscles. Let's see what those nerves look like. Oh yeah, all kinds of nerves. Look at those nerves. All the nerves from the neck are coming down into the shoulder region, right underneath in the armpit. It's called the brachial plexus. Very, very sensitive area. But you can also see that there's these smaller superficial nerves that are all intertwined with the shoulder. So anytime, especially right in here, where this joint space goes away, we can get lots of pinching of these nerves right in there. That's a big one right there. All right, so you see the anatomy of the shoulder. Hopefully you appreciate how complex it is. And I look forward to helping you understand the shoulder more this month. These are hopefully valuable for you, and you begin to get a better understanding of your body in as simple as it can be way. I want to mention that we're going to be sending out video 2 tomorrow, which is going to have the top 5 most common conditions that somebody gets in their shoulder to cause pain with movement. And then in video 3, we're going to send out 3 strategies you can use to begin to get a better, more healthy shoulder. Or if your shoulder's fine, it's a strategy for you to maintain a good shoulder. So hopefully you look forward to it. This month, we are going to be offering anybody with shoulder pain 10 free assessments. So you can come in and get assessed and find out, is it your shoulder blade? Is it the humerus? Is it the collarbone? Which joint is it? What nerve is it? What muscle's the problem? Is it your ribs and your spine that aren't moving correctly, which is very common? So 10 free assessments. Simply reply to this email or call us at 231-944-6541. Every month, these free assessments fill up. So if you are interested, I would encourage you to reach out as soon as possible. Thank you and have a good day.